Hi everybody, happy Monday. I had to take a minute and figure out what day it was, what's going on here. Let's get our setup going as everybody's logging in. Say hello. I don't even know if my little lights make a difference or just make my phone too heavy. Well, we'll see. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. And we are talking tonight about two of my absolute favorite vitamins. So it is late. I am tired. I've been working since 7. So I think that's 13 hours, 14 hours. So in coming up with tonight's talk, I didn't want to discuss gut health, which was originally going to be our topic, but that's a little bit too involved. And it's my favorite topic in the whole wide world, so I could talk about it all night long. Tonight, I wanted to make short and sweet. So we're going to discuss 2 different vitamins, inositol and magnesium. I'm seeing, of course, a lot more patients that are suffering with anxiety and depression, that are feeling safe to discuss anxiety and depression, which is a lot about what this group is about, managing your stress, things like that. So we're going to jump right in. I'm going to be referencing some notes from one of the labs that we work with. One of the talks we are doing this week is about lab testing. We're going to do one specifically on what optimal levels are for blood test results. So I suggest that you poke around and in the next day or so, go on your portal, download your most recent blood work, and we'll take a look at that later this week. The other live video that we're going to do is going to be on some different testing that we do in our office, as far as testing for gut health, testing for vitamin deficiencies, testing for neurotransmitter levels, testing for hormone levels, all of that stuff. So that's coming up this week. Tonight is just going to be focused on these 2 vitamins, how they impact your life, because the 2 of these I think are underrated and are really deficient in a lot of us, and they contribute extensively to mood. So they could really come in handy for improving how people are feeling while they're stuck inside the next, whether this is another week, another month, whatever it may be. So let's get started. Of course, let me know if you're watching live, if you're watching the replay, say hello. If there's something that you want to know about, please ask. These are a lot more fun when they're interactive. And if you're watching it after the fact and you have a question, feel free to PM me or leave the question in the comments, and I will hopefully see that and get to you ASAP. So we're going to talk about inositol, and I've been taking inositol over the years. A very funny little bit of trivia regarding inositol is that it's actually used on movie sets. Hello, Ashley. Thank you for tuning in. I owe you a response to your question. I got it, and I will get back with you tomorrow, I promise. I was with patients since like 8:30 this morning. But inositol is actually used on movie sets whenever they're shooting a scene that involves cocaine. It's inositol. Just because it's a white powdery substance and it works well, and it's obviously not going to cause any negative effects if somebody's snorting it or inhaling it or putting it in their mouth or whatever. So that's just a little funny bit of trivia for you. But now on to the real beneficial information. So inositol is sometimes called B8. Whenever I discuss it with patients, I tell them that it's in the B family. And it exists in 2 major forms, in myo-inositol and D-chiro-inositol. We use myo-inositol in our inositol products. And it helps to regulate cell membrane transport by acting as a calcium mobilizing system. So again, please remember, nothing in your body is happening independently. All of these things work together. So we need to make sure that, you're not going to take magnesium and it's the only positive thing that you do for yourself. You need to be eating right. You need to be exercising. You need to be having healthy emotions. And then if you're still deficient, not feeling as good as you should be, that's the time that you should supplement with magnesium. Now back to inositol. It helps to regulate hormone functioning. It anchors several enzymes to the outer surface of the cell, which is super important. Its key role is in neurotransmitter transmission. So everything we've been talking about these last few weeks, dopamine, serotonin, noradrenaline, acetylcholine, all of these mood stabilizing hormones are impacted by inositol. Low inositol is common in brain tissues of individuals that are depressed. What else is important for you to know? It often displays anti-nociceptive effects, so it can be used as a painkiller. It may increase adiponectin levels. It has potential treatment for diabetic neuropathy. So if you know anyone that has diabetes, that has numbness and tingling in their hands or their toes, taking inositol may lessen the effects of the diabetes or of the diabetic medication that they're taking. It is made in the gut. It inhibits fibrinogenesis, which is actually some of what contributes to Alzheimer's. So if you're looking to keep the brain nice and healthy, you want to make sure that your inositol levels are high enough. It may sensitize the hypothalamus to the effects of insulin. Again, we want to make sure that we are sensitive to our insulin, that we don't need a ton of insulin to combat all of those sugars that we are eating. And inositol is one way to do that. What else is important? It reduces small, dense, low density lipoproteins. Okay, this is huge. Hey, Carrie, thank you for tuning in. So when it comes to cholesterol, and I have to sit back for this one. When it comes to cholesterol, you want to make sure that your physician is testing your particle size. Otherwise, essentially, your cholesterol test is worthless. So someone can have normal cholesterol, and if their particle size is tiny, that means that the particles are like eensy-weensy BBs, and they are running rampant through your vessels, wreaking havoc and causing a ton of damage, okay? Now, on the flip side of that, if someone has high cholesterol, but those cholesterol particles are found to be large, they're large like beach balls, and they are like literally like beach balls at a rave, okay? The beach balls are just being bounced around, no big deal, and they're not doing a lot of damage because they're light and there's not much happening. So you want to be really, really careful about low particle size. So make sure if your physician recommends that you are on a statin, if they tell you that you have high cholesterol and they want to put you on any sort of medication, you need to make sure that they are running a particle size. And even on the flip side of that, if you are healthy, you think you're healthy, and your cholesterol appears to be within normal limits, I always recommend that patients have a full cardiovascular panel run to take a look at particle size, because again, you could have normal cholesterol or within their normal and still have tiny, yes, eensy-weensy deadly particles. So please be careful with that. So that's my quick rundown on inositol. The way that we use it in the office is it's recommended for anxious depression. What we use is a powdered supplement. It's put in water. You don't even taste it. And it's actually, recent research has shown that because of its serotonin boosting effects, it decreases alcohol consumption. So especially like these days where we have no idea what day it is, and it's a lot of people are just acting like they're on vacation and they're having like mimosas with breakfast and some wine with lunch, and it's cocktail time come 2:00. And you may think it's funny, but I was a guest on a webinar for attorneys, and that was one of the big questions was, what time is it okay to drink? And I think that we have to remember that this quarantine is not a vacation. So please make sure that you're being deliberate in your health choices so that, again, you're coming out of this on top. But this inositol actually decreases that afternoon wanting to consume alcohol. So people are drinking less. And whether you think you have a problem or not, and even if you're a casual drinker, under the current circumstances, I would recommend, hello, Mr. Carl, that you consume less alcohol. And if you need some help, Relax Life is a way to do that. So what I do is In the morning, when I get done working out, I've already consumed about 25 or 30 ounces of water. So I'll carry my water bottle around with me for the rest of the day. And I usually have this in it along with powdered collagen and a powdered multivitamin. So essentially I'm getting like all my vitamins out of the way in my second glass of water of the day. The second thing I want to talk about real quick was magnesium. And I've discussed this before. 70 to 80% of the population is magnesium deficient. So if you're not currently taking magnesium, I'm going to go out on a limb and say you probably should. I recommend to patients that magnesium be taken before bed. Depending on the type of magnesium, it can help to release serotonin so that you are relaxed. Again, depending on the type of magnesium, if it's mag-threonate, which actually gets into the brain a little bit better, it may cause vivid dreams. That may be a good thing. It may be not, depending on what's going on in your subconscious up there. But magnesium activates over 300 enzymes. It inhibits platelet aggregation, so some of that high cholesterol that we were discussing, high blood pressure. We want to make sure that cardiovascular system is super healthy. It promotes dilation of blood vessels, and it does that because the mechanism of action of all magnesium is muscle relaxation. And the way that you're able to figure out the type of tissue that the magnesium is relaxing is the salt that's attached to the magnesium. So if you're routinely buying your magnesium at a big box store, and I'm going to assume then that you're taking mag oxide, which is the cheapest form of magnesium. And I would suggest you don't. I would suggest you get a higher quality magnesium, because essentially the job of mag oxide is to sit in your gut and to pull water in. So it's good for constipation, but that's about it. So mag citrate, mag glycinate, mag malate, those are all going to be more beneficial for relaxing skeletal muscle, which is why I usually have patients use it. Again, mag-threonate is great for the brain. So if you find that you experience migraines, if you have headaches, mag-threonate will actually cross the blood-brain barrier and get into the brain. So you'll be able to decrease the incidence and the severity of those migraines. What else? Magnesium is needed for the conversion of glutamate to glutamine. It is a cofactor in the synthesis of glutathione, which again is one of our main detoxifiers. So all of us could use a little bit more glutathione. It protects nerve cells from traumatic injury. So if you are an athlete, if you have a child that's an athlete, Carrie, what's your question? What about thyroid? What about it? Let me know what you're thinking. Maybe send me a private message and we can explain it. We can expand on that. Repletion may improve energy levels and decrease fatigue. So again, if you start taking magnesium, you'll usually notice an improvement pretty quickly. Hello, Amy. Thanks for tuning in. Deficiency causes resistance to parathyroid hormone. It is involved in pain perception and pathways. So literally there's no downside to supplementing with magnesium, but these are some of the things that can be attributed to having a magnesium deficiency. What is going on here? So they're different magnesium, which is best for muscle spasms and severe anxiety. That's a great question. There are a lot of different types of magnesium. So if everybody has a pen, mag oxide is what you're going to find at your big box stores. It is cheap. It is used for constipation. I would not recommend mag oxide. Mag malate, mag threonate. So mag threonate is great for the brain if you have migraines. Mag malate, mag citrate, and mag glycinate are all going to be great for muscles. So that's going to answer your muscle spasm question. And we actually do a combination in the office that is, I think it's the one I have here. So it's mag malate and mag glycinate because they're both great for muscle, and mag glycinate is actually going to help with the anxiety. So that may be something that you want to think about. How many milligrams of magnesium per day? Great question, Amy. So it depends on the person, and it depends on your gut health. So if you're doing one of these higher quality ones and it's mag glycinate or mag citrate, I would typically recommend about 300 milligrams per day taken at night before bed. You don't want to take it with food because then the salt actually gets absorbed by the protein in your meal. So you want it to just go like right to your gut, which happens obviously if you're taking it before bed. If you notice that you take 300 milligrams and you are having loose stools, then back it down, and do 200 milligrams. If you're a person that is taking 100 milligrams of a high quality magnesium, which is something that comes from your physician, ideally, but if not, somebody else, you may need to stop supplementing with magnesium altogether and do Epsom salt baths until you're able to spend some time healing your gut, and then you can get back on a higher quality magnesium supplement. Deficiency of magnesium is linked to migraines. Discuss that. It is well documented for its antidepressant properties. Deficiency can induce anxiety and emotional hyperreactivity. You don't say. It regulates the HPA axis, which if that is not familiar to you, you need to go back and watch my earlier videos. That's hypothalamic pituitary adrenal axis, which controls physical and psychological reactions to stress. Maybe we should have talked about magnesium earlier in this adventure. It is effective in reducing post-operative pain. That's an awesome one. Opioids are on the top of everybody's list for pain, but so is trying to get off of opioids because they are very addictive. So if you're able to do a turmeric magnesium combination, that would be my recommended route. So to wrap up, a couple other benefits of magnesium: it inhibits fat absorption. I am all about that, my friends. Deficiency reduces insulin sensitivity. Deficiency shortens telomeres in animal studies. So one of the talks I did this afternoon was with one of the employees of a company in another neighboring suburb, and they do very specific workouts for osteoporotic patients. Her explanation of telomeres, if you're not familiar, I thought was terrific, so maybe I will share. You can think of your telomeres, if anybody wears shoelaces, or if you think of those like old-fashioned shoelaces, maybe shoelaces are still like this. I can't think right now. I'm so tired. But with the plastic on the ends, the little nub, so that the shoelace doesn't unravel. So you can think of that little plastic nub as your telomere. And you want your telomeres to be as long as possible because your telomeres are a reflection of your health, of how well you're aging, of your longevity. So if your telomeres are nice and strong, like that plastic on the end of your shoelace, then you have, some longevity left. You have some life left in you. If your telomeres are unraveling, like your shoelaces, then it's not a good sign. So we always want to make sure that our telomeres are nice and strong and they're holding everything together. Another not very well-known benefit of magnesium, that it actually inhibits histamine release. So I know a lot of people right now are experiencing seasonal allergies. What does Tammy say? The end of a shoestring is called an aglet. I appreciate the information, but I'm going to tell you that the state that I'm in right now, I'm never going to remember that. But if I'm ever on Jeopardy, I'll make sure that you're my phone a friend. So magnesium helps to decrease the release of histamine. So if you're an individual that is experiencing seasonal allergies, if you have histamine reactions with eating leftover food, you may, again, be deficient in magnesium. I feel like this is like you may be a redneck. If you're experiencing extreme histamine release, you may be magnesium deficient. If you're having trouble relaxing your bronchial smooth muscle, you may be magnesium deficient. So, we want to make sure that our lungs are working the way that they should, that we are inhaling and exhaling appropriately, that we are getting a fine exchange of gas. And again, that's not going to happen the way that it should if you are deficient in magnesium. So be careful with those things. It makes testosterone more biologically active by raising free and total testosterone levels. So gentlemen, you may want to make sure that you're taking your testosterone or your magnesium so that your testosterone levels are what they should be. And high doses of zinc may interfere with magnesium absorption. So this is another reason that it's always beneficial to work with a professional. You know, the information that I give you guys, and I know that even though I say, please make sure that you run it by your physician before you start taking something, I know that not everyone takes that information to heart. I know that when I see patients, they may not be giving me the full story. I know that when they're seeing their primary care physician, they are probably not telling them the full story. And that can be detrimental in situations like this where you think you're doing something beneficial, especially this time of year with everything that's going on, trying to boost your immune system. And zinc is a great way to do that, but you can also overdo the positives and start leaching vitamins from other places. So health is going to be a nice balancing act, and you need to make sure that you have someone that's in charge of the entire orchestra at all time. And believe me, we are not good at being caretakers of ourselves. So we are always better to be able to refer to someone else. And I'll tell you, I have a terrific team of people that are in charge of taking care of me. So make sure that you are exhausting all of the opportunity that you have to get information from people, help them analyze it for you, and then making sure that someone is overseeing the implementation process, because that is key. Physical and emotional stress increases urinary magnesium excretion due to the process of excess catecholamines and glucocorticoids. What does that mean? That means that if any of us on here can relate to having excessive stress, feel free to give me a thumbs up or a heart. If you're having super excessive stress, I would just be pressing that button all day long. But what you're going to be doing is, in order to metabolize all of those hormones that you produce from your stress, so that fight or flight response, that adrenaline that's happening is sucking up all your magnesium. Thank you, Casey Carl, for following suit. It's going to suck all your magnesium and it's going to excrete it in order for you to process that adrenaline appropriately. So again, supplements should be sort of like, it should be ebbing and flowing. You know, you're not going to be on the same protocol that you're on today. You're probably not going to be on in 6 months or in 6 years. You know, I've been out of practice now in practice, I guess. Again, I'm exhausted. I've been in practice for 14 years. So I've been working on all of these things for 20 years. And I will tell you that what I take has ebbed and flowed considerably. And times that I have attempted to oversee my own supplementation, I have definitely made mistakes and fallen short in my own care. I think one of the biggest places for that was probably breastfeeding. I was great with my supplementation when I was pregnant. I was taking probably 10 different things. I was very regimented. And then when I was breastfeeding, which is actually more taxing on the body than creating the baby in the first place, I definitely fell down on what I should have been doing, which I could see in my energy levels and my sleep, in a variety of different areas. So please make sure that you have someone that you're working with that is able to oversee this and look at you as a whole picture and not just symptoms. Again, you know, utilizing supplements in lieu of medications is always my preference, but that is called green medicine. That is not by any means functional medicine. Functional medicine looks at you as a whole and takes a look at your entire history from birth to current to figure out why you're in the situation you are right now, not simply recommending a vitamin based on some little thing. So if there's questions that come up, again, please let me know. These are two of my favorite things. They are available in the office. They are available online at salutogeniclife.com. If you're not ordering from us, please be careful where you're ordering from. Please do not order from online. A lot of retailers, especially one that a lot of us use pretty frequently that starts with an A, has actually been recalled multiple times for individuals selling products on there that are not what they say on the label. I liken it to Breaking Bad, where somebody could be cooking something up in their bathtub or their basement, and they've got a great printer, and they are labeling things to look like a professional grade product, and it may even try to look like something that you have used in the past or bought from a doctor. But unless you are buying it directly from a physician or from a reputable site, literally you don't know what you're getting. So that's my only caveat to taking supplements, is you want to be really careful. So again, the rest of the week, we're going to talk about what optimal lab results are versus regular lab results. We're going to talk about meal planning for stress. We're going to talk about different testing that you could be doing with your functional medicine physician. What is that? Tuesday, Wednesday, Thursday, and who knows? We'll see what's going on this weekend. I hope that you all have a wonderful evening. I love you. Mwah. And I'll see you tomorrow. Bye-bye.